Hello, everyone, and a warm welcome to today's LongITools Policy Forum, Navigating the Urban Exposome for Policy Solutions. I'm Ola Al-Saleh from Beta Technology in the UK, and Beta is a partner in the LongITools project. I will be your host for this session. LongITools is one of the 9 collaborative research projects funded by the European Research Programme Horizon 2020 to study the human exposome. Our role is to ensure that LongITools research findings are understandable and accessible to all of our stakeholders, and where possible, used to help to inform policymaking decisions. Throughout the project, these policy forum meetings will bring together stakeholders around a specific topic or challenge. The aim is not only to raise awareness of our project activities, but to gather stakeholders' input, to get to know each other, and to share with one another knowledge and best practice. I'm delighted to see that today we are joined by a range of international stakeholders with representatives from academia, intermediary organizations, and public bodies. Thank you for taking the time to join us. Before to get started, I'd like to run through some housekeeping with you. I'm sorry, I'm just having some issues with the pinging in the lobby. Just a second, sorry. For our future reference, this event is being recorded and transcribed. The recording will be publicly available after the event. Could all participants please remain muted until you're invited to speak? You will be able to ask our speakers questions after all the presentations are finished. We will then open up the floor for a more general discussion. If you would like to ask a question, please use the chat function or use the raise hand emoji, and you can also use the chat function for any comments or observations. Please like the questions in the chat that you wish to see answered, and we can prioritize those if we become limited on time. The aim is that this is an interactive, informal networking event, so please do use this session to raise any questions, share your experiences and knowledge, and to introduce yourselves to your fellow delegates. So I'm very pleased to welcome this morning's speakers from both the LongITools project and other organizations, each bringing different knowledge and insights. Firstly, we have Professor Sylvain Sebag, who is the LongITools project coordinator. Over to you, Sylvain.
Thank you, Ola, and thanks again for organizing these events. Now I have control, so I can go ahead. Thank you very much, and also welcome to everyone on my behalf. It's always a very nice pleasure and great opportunity to be able to introduce or reintroduce our LongITools project and also the European Human Exposome Network (EN). To all of you. And it's always a great opportunity also to participate and to learn from those policy events, to try to co-create together a cleaner, healthier, and also potentially a more equal societies for Europe. So today I'm just going to give you a brief introduction about the European Human Exposome Network, EN, which one of the goals is to understand health impacts of a lifetime of environmental health. So we are together 9 different large-scale projects, which includes about 120 research groups, many countries in Europe, to try to understand the relationship between environmental factors, environmental pollutions at large, and how this impact the development of chronic conditions such as cardiovascular disease, asthma, but also mental health and other behavioral factors in different age groups. And these are the different health impact or health outcomes and diseases that the EN together is trying to understand the relationship with the environment. So we have, of course, the importance of allergy and immune-mediated disease that can imagine a direct association with the environment, and as well as the respiratory disease, but other diseases that might be less obvious for you, that how the mental and neurodevelopmental disorders are related to change in the environment, in the living space, in the built environment, and also all cardiovascular and cardiometabolic diseases that we are studying in the LongITools project are also related to environmental change, including air pollutions, including noise, including change in the built environment on which we are going to focus on today. So this is one of the main topic and focus of the LongITools project that I'm coordinating here from the University of Oulu in Finland, is to understand how environmental factors, especially noise, air pollutions, and the built environments might relate to the development of cardiovascular and cardiometabolic disease. And you can read from these slides what are the levels of different diseases like type 2 diabetes, like obesity, which not only affects adults, but there is a lot of children suffering from obesity in the world, except in Europe and worldwide. And we are trying to understand how those diseases might relate to the level of pollutions in different places of Europe. And what we are trying to do, especially in this LongITools project, the approach in the LongITools overall, is to engage into a life course approach. So to try to understand how health or diseases is developing through the lifespan, and how it is due to potential interactions between genetic predispositions, and how this is potentially modified or programmed by different exposure that affect you through different windows during the life course. And we are again interested in studying and understanding air, noise, and built environments, and all of those things relates also to the social environments and other factors, and how those contribute to the development of those chronic diseases that I've been talking about already, and how we can try to understand and design some solutions for preventions. So now I'm moving on and introducing a little bit more the aim of the day. We, in the LongITools project, and many presentations that will follow will give you more insight about what we are doing. We are trying to understand how the urban factors, so the urban exposome, how the place where we live, the accessibility of the social networks, but also the accessibility of different opportunity to be healthy or unhealthy, and green space, food outlets, etc. How do things contribute to urban health, and how they contribute to either help us making preventions, or impair the opportunity to prevent properly. So now I'm handing over to the next speaker.
Thank you. Good morning, everyone. Yes, that's the next slide. I'm a brief introduction. I'm Mirjam Weber. I'm a senior policy advisor working at the city of Utrecht in the Netherlands. I'm trained as an environmental scientist, by the way, and now working at the public health department. And I'm the so-called Healthy City Coordinator for Utrecht, as Utrecht is one of the cities joining in a network hosted by the WHO Europe, where I would like to share a little bit of my stories and experiences from as a stakeholder, one of the professionals that is looking forward to get inputs from research like the LongITools. And in that sense, I am myself joining and working in one of the other human exposome projects, which is called Equal Life, where we are focusing on the environmental, or say the physical and the social exposures on children's mental health and cognitive development. And I'm involved in the Expanse project as well, which we have on the agenda later on. So a little bit about, and let's see whether it's going to the next slide. I'm doubting. I still need to get my control. Yes. So what is the Healthy Cities Network? I would like to use this opportunity to briefly to show a little bit more about this quite unique network. that started 35 years ago by a few active European cities that were identifying that they were facing similar problems, similar challenges, and they wanted to become a partner within the WHO and all the work that is conducted by WHO in including health into a lot of other policy domains. This means that today we have a network that is working in its 7th program phase, celebrating this year 35 years of collaboration among cities and with various UN organizations. The network comprises of around 89 flagship cities, like it's called, like Utrecht. Those are cities that are a member as an individual member of the network, but we have cities that are a member through their national network, and in total we have around 1,300 cities, and so we are working and improving this environment for more than 150 million people. Uniquely, the Healthy Cities Network is always having this approach of political commitment. So a mayor or a vice mayor is politically responsible for being a member of the Healthy Cities Network. We have technical excellence supported by various researchers and by WHO. And one of the key topics is community participation. In this phase, this project phase, we have been mapping the city priorities, which is really linking and tapping into what the Human Exposome research is doing as well. It is all about healthy urban environments. It's about health equity. It's about healthy aging, so this lifelong approach, and it's about child and adolescent health. So I think we are all on the same table, on the same page when we're talking about the needs that we are addressing. And in Healthy Cities, this all comes together. Having, like on the left side of this sheet, the healthy urban living for everyone. This is the approach that has been adopted by Utrecht, and realizing that health has to be the outcome of everything that we're doing, whether we're working on infrastructure planning, on building new schools, on the greening of the city to address climate adaptation. It all addresses health and health inequalities. So with the current changes in energy systems, in the mobilities, in the climate adaptation, it all in the end is about addressing health and health equity. So in the Healthy Cities, this all comes together. We work with partners and participation is key. And we do that not only in policy making and in implementation, but we are trying to involve citizens, organizations throughout the cities, research institutes, and private organizations in order to make the shift from health in all policies to health equity in all policies. But in this case, and this policy forum, this online webinar, be aware of the elephant in the room. The elephant having two meanings. It's when we're saying, okay, we're not addressing a difficult topic because we are a little bit hesitant on how to make this explicit. But on the other hand, this is illustrated by the picture, seeing that the whole picture and being aware of other perspectives. And this is something that we are experiencing, for example, in the Equal Life project, where we said, okay, we want to involve stakeholders from the beginning of the research. And then the first question is, but who are the stakeholders? Which professionals will benefit from the research? And that could be professionals like my colleagues working within a city, but it could be people representing national governments or even international governments and the European Union of the WHO. But it could be professionals working on the ground in an NGO or in a technical organization. So what does it mean to have stakeholders involved in your project? Are they even allowed to identify their own research questions that you would embrace? So what we did in Equal Life is that we started really early on in identifying the stakeholders, having interviews with them, and we have at least twice a year workshops together with the researchers in the project, and with colleagues of mine from the Healthy Cities Network. So Cork, Helsinki, Udine, Leipzig, are all cities that are a healthy city, but that are joining in our Human Exposome project. And what we, for example, did was in the stakeholder involvement is that we developed personas. So we identified people that would be relevant for the outcomes or even the research itself and then its outcomes, in order to be aware constantly in our work, do we have something where we need a politician in, or do we need to reflect on what a spatial planner within a city would look for? And in this way, we are sort of ensuring that we have all the different perspectives on board when we are developing our tools, our toolboxes, our communication materials. So where does policy and science come together then? In Utrecht, we have an international strategy and where we have identified 4 key reasons to be internationally active and thus to collaborate with lots of organizations and institutions internationally. The first one is knowledge. Cities around the world face similar challenges, so exchanging knowledge at an international level and building knowledge networks contributes to better policy for cities and regions and member states, enriching our own knowledge and skills and professionalization of the organization. The other reason to be internationally active is influence. We want to have influence. We want to be at the table, sitting at the next COP on climate change. And changing European policies. What is on the agenda in Brussels? What is to be integrated in new legislation that we have to implement at a local level? And how does new research fit in that agenda and in that new changes of legislation, for example, on air quality and on noise? The Environmental Noise Directive, I think there are ample improvements possible there. The third reason is funding. You can imagine, as a city, we want to test, we want to be a test bed, we want to be a pilot, we want to scale up all the initiatives and the new knowledge, but we need funding for that as well. So cities are really eager to be a member in European consortia as well, like we are doing in Equalife. And then the fourth reason is profiling. When you are known, like myself, being internationally active and representing the work in Utrecht, but the questions and the challenges we are facing as well, then you get the opportunity to join in these kind of policy webinars. And I'm now currently in Valencia in a high-level meeting on healthy cities, hosted by the Spanish Ministry on Public Health. So that is one of the reasons as well, and that's where you can tap into knowledge and contacts at city level. So with this, I would like to end. I'm open for any question, and I would like to invite you, when you have the opportunity, come to Utrecht, where in November, the 21st until the 23rd, we are hosting the annual meeting and conference of the Healthy Cities Network. So if you are in the neighborhood, trains are running, planes are flying, will be lovely, because there you have the opportunity to meet with lots of 300 to 400 people working in European cities throughout Europe. Thank you.
Many thanks, Miriam. That was very insightful. I just want to remind the attendees that if you want to ask any question, please use the chat function or use the raise hand emoji. The next 2 presentations are by my LongITools colleagues, starting with Dr. Winlon, a researcher at the Interim Institute in France. Over to you, Winlon.
Yeah, thank you, Al, for organizing this policy forum. Let's. Okay, I should have control. So hi everyone, so I'm Wenlan Yuan, and I'm a researcher from the Interim Institute in France, and I'm a part of the LongITools Consortium. So today I'm very glad to contribute to this policy forum by presenting my results on the urban environment and children's cardiometabolic health. So based on the United Nations last report, urban population doubled from 1950 to nowadays and reached 60% of the global population. From its projection, it will keep increasing in the coming decades, which lead to this tagline, "Our future is urban." So in comparison with rural areas, urban areas have undeniable advantages, such as greater employment opportunities, improved transportation and communication, access to quality educational and medical facilities. But living in an urban environment could result in greater exposure to air pollution, noise, but also limited green spaces that are known to be detrimental for health. So what we know about the interplay between environmental stressor in an urban setting is that built environment influences both the levels of vegetation and air pollution, and that vegetation helps to reduce urban pollutants, and that all of them could be affected, and all of them could affect health. All these environmental stressors may differ following the type of climate where people live, which is a combination of temperature, humidity, and wind. So among the environmental stressor, air pollution is considered the fourth biggest global health risk factor, contributing significantly to the two leading causes of death worldwide, which are ischemic heart disease and stroke. Not only air pollution, but also neighborhood greenness and the built environment composing the urban environment could increase the cardiometabolic risk by increasing the risk of adiposity, diabetes, dyslipidemia, and hypertension that are important risk factors of cardiovascular diseases. So our exposure to urban environment begins in the womb. So indeed, evidence showed that our accumulated exposure since the prenatal period to multiple environmental stressors of the urban environment could be linked to an adverse fetal development and lead to greater cardiometabolic risk in adulthood. These evidence are substantiated by the developmental origins of health and disease framework. So consequently, the aim of our study was to investigate whether we can observe the influence of prenatal urban environment on cardiometabolic health since childhood. So what we did, we used data from a French birth cohort study that recruited pregnant women during their first trimester in 2 cities. So please note that these 2 cities differ notably in their climate. Prenatal urban environment was characterized by the level of air pollutants, so NO2, PM2.5, PM10, ozone, and black carbon. The vegetation coverage was measured by NDVI, and the built environment, which include multiple features, were grouped into urban, semi-rural, and rural. So children cardiometabolic health parameters were measured during the follow-up clinical examination that occurred at 5-6 years of age, and cardiometabolic health parameters included adiposity, blood pressure, and blood parameters. These parameters were combined into sex-specific phenotypes to account for their intercorrelation. So we identified 4 phenotypes in boys and in girls. So in boys, we have higher adiposity, higher insulin resistance, and healthier lipid profile, and high blood pressure. And in girls, there were high adiposity, healthy lipid profile, but high blood pressure, high insulin resistance, and unhealthy lipid profile, and high blood pressure. So what we found, the findings here are presented by cities because we analyzed them separately to account for differences in the climate and local policies. In Poitiers, we found that living in a more urbanized, living in a more urbanized environment prenatally was associated with lower adiposity in both sexes. Living in a more semi-rural environmental prenatally could be associated with a lower likelihood for girls only to have healthier lipid profile and higher blood pressure. Living in a more rural area prenatally was associated with a higher likelihood for boys to have higher blood pressure and insulin resistance, and for girls to have higher insulin resistance and unhealthy lipid profile. We observed no overall association between vegetation and air pollutants with children cardiometabolic health. So in Nancy, living in a more semi-rural area prenatally was associated with lower likelihood in boys to have higher insulin resistance, higher level of ozone was associated with higher likelihood in boys to have an unhealthy lipid profile. Higher level of PM 2.5 was associated with a lower likelihood in boys to have higher blood pressure and with a higher likelihood in girls to have higher insulin resistance and unhealthy lipid profile. And we observe no overall association between vegetation with children cardiometabolic health in Nancy as well. So what are the take-home messages? Here we use a real-world environment approach by investigating the influence of coexisting urban environmental attributes. We observe cities' specific associations. In Poitiers, children whose mothers were living in a more urbanized environment during pregnancy had a lower cardiometabolic risk at ages 5-6 years. In Nancy, adverse association was observed between air pollutants and lipid profile, independently of the level of vegetation coverage and built environments. And overall, no association were observed between prenatal vegetation coverage and children cardiometabolic health, independently of the built environment. So finally, this study suggests that under certain conditions, living in an urban environment could be rather beneficial for cardiometabolic health than detrimental, and this could underline the importance of designing healthier cities for future generations. So what's next? The perspectives of this work will be to examine the influence of prenatal urban environment exposure on cardiometabolic health at different stages of life, explore differential effects, meaning differences across European regions, which will provide benchmarks for translating research into practice. And among the type of built environment associated with cardiometabolic health, we will examine the influence of each built environment attributes that are more amenable to modification. And finally, we will explore pathways such as physical activity diets through which urban environment might influence cardiometabolic health using appropriate methodological approach. So thank you for your attention, and please follow us on our potential social media.
Thank you, Wanlan. I would like now to introduce Dr. Jules Kirkos, a researcher at the Institute of Risk Assessment Sciences of Utrecht University. Over to you, Jules.
Yeah, thank you, Ola. So my name is Jules, and I will be talking about mobile monitoring of air pollution, which is a project that started off with a collaboration with Google Street View, since they were driving in every street to take pictures of all the streets anyway. So we demolished one of the back seats of a Google Street View car, installed air quality equipment, and drove around in Amsterdam and Copenhagen for about a year, and were in that way able to make a very detailed map of, in this case, Amsterdam, where we have very localized and hyperlocal view of how the air pollution is in every street in the city. And why we do this is that we can measure a lot of locations in a short amount of time, because usually the air pollution is measured with a few stationary sensors in every city. But with a mobile sensor, you only need a limited number of devices, and they're so very costly and need frequent quality control. You can measure on a lot of different locations. Another example of this is when we have yearly phenomena in Utrecht where professors go out on a bike to local primary schools and teach their subject for a morning, and they all start at the academy building in the city center. And last year they were all going by bike and installed with a air pollution sensor on their bike. And when I click on play, you can see that how quickly a lot of air pollution samples can be collected with a few mobile monitoring devices. So they all went out on their bike in the morning with their sensors. You can see some higher pollution levels on some places, And when they returned, the air pollution dropped a bit, and you can see them all return to the city center with a lot of local data of how the air pollution is in the city. Then the question is, of course, how many times do we need to measure? Because these measurements only take like a few seconds per street segment. So difference in meteorology, you can be measuring in rush hour or in non-rush hour. You can have incidental events like a moving truck, and you suddenly have a very high measurement of air pollution, which might be just coincidental. And you have to, of course, take wind direction into account. This is an example of measurements in Copenhagen, where you can see the airport in the bottom right corner. And in purple are the highest air pollution levels for ultrafine particles. And you can see on one picture, the pollution levels are more to the left of the airport, and on the right picture, more in the north. And then if you zoom in and look into the data, we found that indeed that the wind direction was blowing from the airport to the higher pollution levels in both pictures. So especially from a point source or a localized source, the wind direction can be very important. One way to deal with this is also to use models to smooth out the incidental peaks of air pollution. But then you sort of lose all the hyperlocal variation. And if we just use the data only map, you can still find hotspots, cold spots. But the downside, of course, is that you need huge amount of data and cannot really be extrapolated to places where you haven't measured. So we came up with a solution, and that is to use a mixed model. I will not go into too much detail, but it sort of combines a land use regression model, so a model for the air pollution in a city with known factors, but also combine it with the measurements itself. So it sort of makes a model out of the city, but lets every measurement on every street segment still contribute and lower or higher the concentration level on that street segment. And this way we can do some extra analysis on a city, in this case Amsterdam again, where we can look at some hotspots where the concentration is really higher than places like really higher pollution levels. And you can definitely see the ring roads, the highways popping up, and also some localized places in the city center where maybe some unexpected hotspots can be found, maybe to local industries or other factors, which typically cannot be found by a land use regression model. You can also look at some ratios between pollutants. Here, for example, nitrogen dioxide and ultrafine particles, where you can also see the really elevated ultrafine particle levels, also compared with nitrogen dioxide on the ring road, but also on the left side of Amsterdam where the airport is. So you can still find some elevated pollution levels that way as well. And one last example I want to mention is that we also did this in Copenhagen. This is one neighborhood close to the central station, where we also mapped the ultrafine particles and collaborated with local architects, urban planners, to map where the pollution was higher and where it was lower, and combine this where children went to school, so where the kindergarten are, and how many children spend time on certain streets. So that way we can try to reduce exposure levels on streets where there are a lot of children, and try to invite children to places where the air is cleaner. And this is an example of also the architects where there's a busy street with a lot of parking and stop and go traffic, but you can see that a lot of children and small children being here, and because of their height they also even closer to the exhaust of cars, so that's could be a reason to try to make this place a bit more healthier. And one way to do this is to create like a sort of buffer and a barrier of green space, removing the parking spaces, so children can be breathe in healthier air, to a simple solution of putting in some greenery in between. And the opposite is also true, where the pollution is less, but there's not so inviting environment. You can try to, and this is just a drawing that tried to invite and make the space more appealing for people to be. So since Amsterdam and Copenhagen, we've been driving in multiple cities in Europe to try to make to do this and try to create a European map of especially ultrafine particles that does not exist yet, but also have localized hyperlocal maps of the cities that are mapped here. And we're trying to expand this as well in the near future. So if cities or universities are interested, please contact me, then perhaps we can even broaden up this map. So with that, thank you for your attention.
Thank you so much, Jules. It was very interesting. And finally, we have Johannes Hilama, the project coordinator at the Oulu Business Center. Over to you, Johannes.
Thank you. It's a real pleasure to be talking here with all of you. My key message is that let's start talking about quality of life. And the topic is connection between urban city planning, urban health, and quality of life. And like Ola said, I'm working in a business center of Oulu here in Finland. And I'm a futures designer here in Finland. We are collaborating with the citizens and business owners in our city center. And but when we are doing participatory urban planning, this is my starting point, because if you use questionnaires to directly ask people what they want, you are guaranteed to get wrong answers. And most of the time people don't know what they need until they witness how things can be done in a better way. But however, by the time that happens, people already want something entirely different. And this is challenge to us when we are making participatory urban planning. And that's why we are not asking citizens how should we make city center better. We are not asking about ideas. We are not interested about their opinions, but we are asking what is meaningful and important to them, and the reason for that, why things are important to them, what the important meaningful things are, and what is the reasoning, because we can use that reasoning in urban planning. And this is one of the questionnaires we have done in Oulu. There was a claim or statement that I find the city center of Oulu beautiful. And when people thought that this is, they agree with this statement, and that this is important or meaningful to them in everyday life, it asks another question, and that question is why. And there's an answer of anonymous resident here in Oulu, Beauty Inspires, and it's talking about cycling routes along the waterways and also parks. And that's why we are linking urban city, urban health, and meaningful life together. It all is intertwined together, because quality of life here in Oulu is being able to cycle through parks and along the waterways to work and study. And this way we are trying to collect not only hard data, because it doesn't answer the question why, and we are all in futures design, when we are making city centers better, healthier, and we are talking about quality of life, we are really interested about soft data, the deeper experimental understanding of people's everyday life. And there's a straight link between quality of life and sustainable lifestyle also. Professor Arto O. Salonen here in Finland has said that in Finland we have recognized in our studies that people who adopt more sustainable lifestyle, if possible, they are more satisfied with their own lives. So there's a direct link between sustainability and quality of life. And cycling through the parks and along the waterways are really linked to those both. And in our project, we are also doing a new European Bauhaus initiative. We are doing that together with EU. So we are doing more together, more sustainable and more beautiful city center. And that's our main goal when we are working with the citizens, city and business owners of Oulu. And my main idea is that we don't need to talk about standard of living every day. Here in Finland, we are almost always talking about standard of living, and it's a main theme in politics. But can we start talking also about quality of life, because interaction between people and urban living environment and its connection to different lifestyles and perceived quality of life is a really important thing. And the key would be, how can we strengthen the interaction of decision makers, residents, and scientists with the citizen science in a way that we are talking about all those different stakeholders are talking about same thing, everyday life of ordinary people, and at the same time the better quality of life. And this is the way I think we could improve our city centers and take health, urban city, urban health theme in a big way to our urban planning, and start to make our city centers more beautiful, make those city centers more together and also more beautiful. This is actually my presentation. I thank you for your attention, and if anyone is interested about questions and cooperation with us, let's just let me know.
Thank you so much, Johannes. And thank you to all our esteemed speakers for their insightful presentations. Our discussions today have touched upon some profound intersections of urban planning, health, and policymaking. And as we transition to our plenary session, we'll delve further into key topics, offering our speakers a chance to expand on their perspectives. Additionally, our audience will have the opportunity to engage directly through a Q&A. So it's a chance now. If you have any questions or anything or follow-up questions that you would like to ask, please use the chat function or the raise hand emoji if you'd like to speak directly. Do we have any questions, Claire, in the chat? I can't see it right now. Okay, stop sharing and maybe I can see the questions then.
No, there's nothing else.
Okay.
There is one now.
Yeah. Yes, Nicola Robinson. Yes. Stephen, can I please ask you to give Nicola that unmute, please?
I've done it, but it doesn't seem to have unmuted everyone.
Just sorry, Nicola, just some technical issues. Let me just try. Can you try speaking now, Nicola, please?
Yes, my mic has been enabled. Thank you very much.
Thank you.
But you don't need to see me. I'm from DG Environment in the European Commission. Really interesting research findings. I had a question for Wenlun Yuan about the research in Poitiers and Nancy. Were these findings unexpected? I mean, I'm thinking particularly of the Poitiers findings where mothers in a more urbanized environment had a lower cardiometabolic risk, the children. Was that unexpected? And then also the fact that there didn't seem to be a positive link to vegetation coverage, that seemed to be not a factor in either city. That's quite interesting. And well, perhaps while you're answering, just clarify what was meant by vegetation coverage and how it relates to sort of plans for urban greening and such like. That would be really interesting. Thanks.
So thank you for your questions. I try to remember all the questions. So the first question was, it's okay. It's okay. So your first question was about differences. Why did I expect to find that urban environment was associated with actually lower risk of cardiometabolic outcomes, right?
Yes.
So there is evidence in the literature saying that actually living in a more urbanized environment is contributing to a better cardiometabolic health. Because, okay, so there's multiple mechanisms, multiple pathways, but as I introduce it, when we're living in a city, we have more access also to medical facilities, to quality education, so that actually will improve our of overall health actually. So and also we have also more access to public transportation as well. So we are more mobile. There are more possibility for walkability compared with living in a rural area where we are very dependent of the cars. Yeah. So there is now accumulating evidence that actually saying that living in more urbanized environments could be beneficial, but of course I believe it's under certain conditions. So that's why we found that what we found in Poitiers, we didn't find it in Nancy. So that leads us to think that maybe it's really also depending on the urban policies. So that's why we need like more replication in other city settings with different urban policies and see whether we can find like consistent results. Your second question was about vegetation.
Vegetation coverage, yeah. Kind of what that meant and links to sort of urban greening and
Yeah.
whether it's not as useful as we think if it didn't affect these results at all.
Yeah, I think it's important first. So what we use is the vegetation coverage. So actually, it's images of the greenness of the surrounding environment. But actually, what is important is not like it's not reflecting necessarily like having parks for kids. It's not reflecting really the quality of the greenness. Because we could live in like close to a forest, but if there's no like pedestrians, like pedestrian road or biking road to access to it, or to like engage, like to use it, actually it's maybe not beneficial in terms of physical activity. So I believe it's how to think of the quality of the green spaces
and the accessibility. Yeah,
exactly.
Yeah, oh, that's really helpful. Thank you very much.
Welcome.
Thank you very much, Nicola, and thank you, Wenlan. Just to let you know, Miriam unfortunately will have to leave in 10 minutes. So if anyone has any burning questions to Miriam before she does. Okay. Yes, Sylvain, please go ahead.
Yeah, I do have a questions to Miriam, because it was really, really interesting, and really impressed by the work that you have doing and what and these WHO healthy cities. So very genuine questions. How can me as a citizen of Oulu, I can convince my city to join this network? Have we got a role as citizens to do that, or as a researcher? How does it work for Utrecht to be joining that? Do you remember?
Yes, yes, sure. We're not even that long a member. We became a member in 2016, compared to some cities that are a member for already 35 years. And that was because our politicians had this ambition and this vision about Utrecht healthy urban living for everyone, and they wanted to have that as a kind of international branding. And then we learned about the Healthy Cities Network of WHO, and then we said, okay, then we need to be a member of that network, evidently. But in general, I think everyone could suggest to become a member, whether it's from the citizens or from the researcher side, or just the people being aware of it. There is a procedure to become a member, so it has to be initiated by the mayor, because it's really important to have this political commitment, as the politicians have a role in the network themselves. So in the meeting in November, we will have a high delegation of mayors throughout Europe joining for that meeting and agreeing upon what are the topics that they want to talk about. Well, we do have quite a strong link with academia as well. We do have, in addition to this political committee, where we have a selection of 17 mayors that are preparing the political agendas every time, we have a scientific committee as well, where we have professors, researchers, advising the Healthy Cities Network and WHO on what are the topics that we need to address. Where do you as a researcher see the importance? And like we are always saying, as a city or as a politician at a local level, you have a certain amount of money that you can spend, and you want to spend it in a way that contributes to your citizens, to have them as a healthy and a sustainable city. And research in that is key, because you can only invest your euro once. So you want to do it in a good way. And that's why, like I said, it's so important that we as cities are communicating, are joining with researchers, and maybe jointly even influencing the European agenda and European legislation. And the Healthy Cities Network is a way to do so. So yeah, convince your mayor of Oulu. Yes, would be good.
Work with that, Johannes.
Yeah, and there is, like I said, there are some national networks. The Netherlands doesn't have it because Utrecht is the only city being a member. But for example, in Finland, in Denmark, in France, Germany, UK, there are national networks. So there are quite a lot of cities that decide not to be a designated city like Utrecht to go through the whole procedure, but to become a member of the national network. And the national network is being designated, so they have to run the procedures. And there are several Finnish cities, but throughout Europe, like I said, that are a member.
Thank you so much, Miriam. Yeah. I think we have one more question. We'll be able to take that before you leave.
Yes, that's fine. Yeah.
So from your extensive experience as the policy advisor, so just like Sylvan's interested with Oulu, I'm sure other cities are also interested. So what recommendations do you have for cities that are just beginning their journey towards creating healthier urban environments?
I think there are a few, and one is a little bit difficult to influence because that's the political climate. In Utrecht, we were lucky that we are having left and green political parties leading the local government already since 10 to 12 years. So then it's easier to address sustainability, equal opportunities, and health. You need this political commitment, but as a researcher or a citizen, or as a citizen, you can sort of influence it, but as a professional working at a municipal hall, you can't. But that's one of the key reasons that that you have health on the agenda and sustainability. The other one is develop long-term strategies. In Utrecht, we have an urban planning strategy for 2040 in which we introduced the 10-minute city. So saying, okay, every citizen should be able to reach schools, education, health services, you name it, green, within 10 minutes walking or biking distance. And this is a strategy that is valid until 2040 at least. So independent from the political terms of 4 years. The same goes for our public health policy plans. We have a constant building every 4 years on public health policy plans, and where we make the linkages, and it's not the plan of the public health department where I'm working, but it's the policy plan of the whole organization. So it is about urban planning, it's about work and income, it's about education, it's about the social services. It's all in that plan. And that's my third recommendation. It's interdisciplinary working. You need to link to your colleagues with infrastructure, with the green and biodiversity, with the work and income department, to learn your language and to establish interdisciplinary teams. And building this, for example, for physical spatial planning, we have interdisciplinary neighborhood teams where colleagues from noise, air quality, green, health, infrastructure, economy, whatever, they are meeting on a 2-weekly basis, discussing all the plans, all minor and big plans in that specific neighborhood, and then agreeing on what are the priorities, where do we need to focus on, what kind of issues do we see here, and how can we address this in our projects, programs, and new policies. So it's about, that's about interdisciplinarity, which is really key. And in that case, you're more open to including other perspectives from researchers, from international colleagues, from the WHO, from the citizens. I fully agree. You need to listen to the citizens as well, and not only collect the data, but collect the narratives and the stories. So that's sort of my list of tips, what we learned during the last years.
Thank you so much, Miriam. That's really useful. And if anyone has any further questions for Miriam, please feel free to drop them in the chat, and then we can send them over to Miriam. She can kindly get back to us later on. Thank you so much, Miriam, for joining.
Yes, thank you. And I will leave you then. Bye-bye.
Bye-bye. Take care. I think, Johannes, the same question was also addressed to you. What recommendations do you have for cities? And I think you touched upon the quality of life and prioritizing quality of life rather than just standards of living. So maybe you would like to just add to that from your perspective. What are the recommendations you have for cities to create healthier urban environments with better quality of life?
Yeah, my answer would be involving people to the discussion. Politicians usually take really close look on if we can really show that people, citizens in Oulu, are thinking in a in certain way. In our project, we are making a desired future narratives with the people. So if we are succeed on those stories that people can, citizens relate, I think there will be much more political pressure to take these issues in more seriously, and that's probably my point of view to this discussion. My opinion is that it's more important to the perspective of dealing with the issue is more important than focusing on certain problems or certain things. So I think the quality of this discussion of quality of life is really important. And through this conversation with the decision makers, city officials, residents and scientists, we can build an understanding of everyday life and maybe choose desired future together and invest in quality of life of people. And I think politicians are interested about these themes. If we can show that citizens are really interested about those also.
Thank you. Can you hear me? Thank you, Johannes. Thank you so much. So I think you've touched upon a lot about community engagement and engaging all potential stakeholders and politicians. And I think that's the tricky part, and that's what we're trying to do in various projects and how to make sure we capture all of these needs very well. Sylvan, you had a question. Is it for Johannes specifically?
Not specifically. It can be addressed by everyone. I think it's also, I think it's very, very interesting. Very happy to see also the presentations by Wen about these associations where we are using different types of samples in the populations to try to interrogate those associations or to engage with some part of the population, samples of the populations, to know what they feel, what they are interested in. But we also know that we are missing many invisible observations and problems, and that it's often people with higher social opportunity that participates to those projects. It's also people with interest or higher educations that might join your engagement participation. So how do we try to continue engage with those who are maybe in higher, although we don't know their needs, but we think that they have higher needs. So that's what are the strategy maybe for you, Johannes, or what are you feeling? Maybe Jules also, this is really fantastic how you engage with the populations to be able to contribute to know what is the quality of their environment and how this can be added together. Sorry, it's many questions. It's also many not easy to answer.
If I can answer the first question, I would answer it by saying that if we succeed on talking about everyday life of the citizens, and we find really the important and meaningful themes to citizens of all, and we are making a development project to those themes, then we can involve people who are not high educated or have higher needs, and actually we have succeeded in those in a small scale. So if we can find the really important and meaningful themes that are important to people, we can engage also people who are not so active or not in special needs. And I think it's even also as important to engage silent majority, people who are not participating normally. So I think this is a really important question, and we are trying to find answers to you every day.
Thank you so much, Johannes. Jules or Rana, if you'd like to follow up on Sylvan's question, and just to reiterate, I think Sylvan, you've highlighted some of the gaps currently that are different research and not being able to capture those who are not as fortunate as others, those from lower economic, socioeconomic status, vulnerable populations, for instance, or those in more remote areas. So again, these are all maybe research gaps that exist in current research or evidence. So how would you, Jules, maybe, and then Wenlon, recommend to address these as well?
Yeah, that's indeed a difficult question to answer. It is indeed, I think, also a session about the urban exposome, and so the rural population is maybe a little more tricky to get to. But I wouldn't have the answer to that.
Yeah, I think it's a hard answer. I think we're all trying to reach out to those who are not easy to reach out. But I think the whole point of this forum is just to have all these different perspectives and thinking together and see how we can build solutions future on and addressing these research gaps. Hopefully we can get out with key messages by highlighting that. Wenlon, do you have anything that you would like to add from your perspective?
Yes, I agree with Jules. That's a very tough question. How to reach more vulnerable population in terms of socioeconomic position. I mean, I only have like some example in my head, but like we know, like for example, I'm taking the case of Paris because that's where I grew up. But we know that low socioeconomic population tend to be like far away of the city center, and most of the time they have also less access to public transportation, and even if they have parks, there's a safety questions that makes the park, like even if it's accessible, there's a safety reason for families not to go into the parks. So yeah, I think it's really hard to like transport our findings on high income population to any other population, and especially below socioeconomic positions. And we definitely need more evidence on this, and eventually coming from intervention studies as well. That could help in the causality questions. But yes, I think that's a tough question.
Yeah, I think that's true. And I mean, when we try to influence by urban planning, I mean, the plans are being made 20 years ago. So we need to be there as early on as possible to make these interventions already happening in the architectural phase, in the planning phase.
Thank you so much. Thank you, Winman and Jules. Does anyone of the audience have any additional questions that you would like to address to the plenary? Please feel free to put it in the chat or just raise your hands. Sorry, Rahab Bazoki, you're unmuted? Did you like to ask a question? No. Okay. Maybe a question to you, Sylvain, that I had. So how do you believe the interplay between urban environments and health will evolve in the coming decades, from your experience?
Wow, cool. A tricky question for me. Yeah, thanks a lot. So, okay, but can you?
Yeah, sure. It's just how do you think? Just how do you think, from your experience and your research and working with the urban exposome, how do you think this interplay between urban environments and health will just evolve in the next decade? Where do you see us going in the future?
Oh, well, we should discuss with Johannes, because he sees the future. I'm not sure I see the future. I see many possible futures, and there are many possible what if scenarios that are always a little bit blurred, as we know, with our hope or our fear of also what can policy can decide and what things can happen. Well, if we look at, usually when trying to understand the future, you try to understand a little bit the past and what has been developed during the past years. So what Jules has been mentioning is very important. We now realize that the decision that we took 20 years ago, we are starting to see their effect, positive or negative, now. So that's and we are also trying to understand and explore why and try to prevent these things. So that I'm quite hopeful that now there is a little bit more health in urban planning, and that will be one positive thing that should happen more often. I'm also very hopeful that activities like what Johannes and what Miriam is leading are going to drive citizens towards more healthy and more inclusive behaviors. Trying to, but that's okay. I'm a dreamer. I'm also an academic. I believe that we can do that, and we have opportunity to reach. But we also know that it's very fragile situations that is not only affected by the policy, but also by the health in general. So there's also the need to invest not only on the environment, but also on the health, because that I think that's, or I recommend that we also engage much more bi-directional association type of research. So to realize that the health of the cities or the health of the citizens is indeed affecting the quality of the environment, and that's something that is also very important to recognize and to really have again this exposome approach. So I think then when indeed you realize that a city environment can be healthy in a way, or can promote or associate to health, it also means that we are making it at the expense of other types of environments, and we are losing people in the problem. So I think we have a lot of work. We have lots of examples that it can work, and we have lots of examples that it's not so expensive to make it work. And so, yeah, I don't know whether I answered your question about the future. I think the future, if I would like to say one thing, is that it's probably in intervention. Now that we move from observations to try. That's it.
Thank you, Sylvain. Obviously, we can't tell what the future health holds for us, but with all the efforts that have been put and with all the knowledge that we have that we didn't have years back, we can plan better, I think, for a better future and know what needs to be addressed in a better way. Anyone else that has any questions for our plenary before we close? No. Okay. Nicola has also kindly shared the link to the EU Green City Accord. If you're interested, you can check that in the chat as well. And if there's no further questions, maybe I can ask the plenary just for 1 or 2 sentences, like key takeaways for the audience today before we close up the session. And maybe we'll start with you, Johannes.
I think I said it earlier about starting discussing about quality of life together with all those stakeholders. That's really important, and that would lead us to better use of science, health science in urban planning.
Thank you, Johannes. And over to you, Jules.
Yeah, maybe I can follow up on that. It's what I said earlier. It's important to keep in mind that I mean, urban planning is done already some time ago, or what is being done, we get the results years later. It's another example of Utrecht, by the way, is that we're designing now a neighborhood where they promoting it as we can live there 5 years in good health longer, with some adjustments with greenery, with air pollution, with no fast food chains, with no and only shared cars. And it would be really interesting to see how that works out in the future.
Thank you, Jules. One more.
Maybe a take-home message is also to think beyond urban health. So thinking about the One Health approach, like the world's health, the urban health depends on the world health, on all the different level of health. So maybe it's something also to consider in our future research. So.
Thank you, and Sylvain, a final key message. You're muted.
One word, collaboration.
Agreed. Well, thank you so much. I'd like to thank the panelists and attendees for this enriching discussion. These intersections between urban spaces and health, as we've discussed today, are intricate and they demand multidisciplinary collaboration, as Sylvain has just highlighted. And a heartfelt thank you for all of you for making this forum very enlightening and productive. I'll just share my slides again. So to conclude, the outputs and tools from the LongITools project and other EHAN projects will become available on LongITools website and the EHAN website as they arise. And our next policy forum is scheduled on the 20th of March, 2024. To stay updated with the LongITools project, please follow us on Twitter or X or LinkedIn, and you can also contact us via our website. Your feedback is very valuable, so please take a moment to fill out the event feedback form that Claire will be sharing now on the chat. And if you have any suggestions for future topics, we would love to hear back from you. And just to conclude, I just cannot emphasize enough the value of your participation, and a massive thank you to our esteemed speakers for sharing their insights. And I really hope to see all of you again in future forums. Wishing you all a wonderful day ahead. Thank you.